He does fine. One thing that, that's pretty much it. This is probably the easiest one that you'll have to do. Good job. Good job. I like it. That's exactly what a real scrub tech will tell you too. Get the fuck away from my table. Good. I'm liking that. Why don't you go ahead and get her ready for knee procedure? Just think about what you might need. Now her leg's probably going to be bigger than that tourniquet, but I like the way you were thinking. But you can try it. Try it. What's this for? He's got something.
Oh.
We just rolled it up from the back.
So this is going to be a, way up here. It's going to be a thigh tourniquet.
Make it work.
Don't you drip on that table.
Nathan, hold the leg.
Look at the doctor helping. I like it. This is real life. This is real life. I like. So the higher the better.
This guy over here, what's he doing?
Get that sucker up as high as you can get
Looks
it.
confused. What's he doing over there?
Get it dry before you. You won't need a towel. Non-spot
Good
rinse
scrub.
there.
Oops, sorry.
Oh, I was getting ready to do that. So the only problem with what you did is you already got your gloves on. Now you need someone to open this up for you. Dr. Kevin. What else do you need? Yeah! Yeah! Woo! See, I get so excited over stupid shit. It's ridiculous. I'm liking. I'm missing one. Which one's she missing? Because we won't put one there, so you can take that one. The knee. Very good. Yes, sir.
Because the one like where you break it and put that on it, then for the spread, this one they just put that on the sponge and that.
Well, what I would have done is open this up and poured the betadine on, then put my gloves on, then reached in and grabbed it, and then start to scrub.
You get a sense of still sterile since I put it on the bottles.
Well, but the only problem is you need someone to pour the betadine because the betadine bottle is not sterile.
Clutch to the rescue.
Do it right, yeah. Good job. But what you're going to need to do is hold the leg, because I don't have a leg holder, so you're going to have to hold the leg up. You're going to need sterile gloves on too. This is something that happens to us a lot, where I say, well, hold, while the nurse scrubs the leg. Got it? No, you can get them up there. Get them all over the toes. Smear it all in there.
Yeah, in
Real
between.
life.
Make sure to put it in between, Kevin.
You're gonna need more betadine.
Just skip the sponge and just spread it all over. Shmee it out in those toes.
Nope, I was throwing curveballs at everybody.
That was the good one.
Good eyes, so good.
See, here's the problem. You're so far thinking ahead, you forgot he needs to be tied up. So the doctor's running around doing your job.
Oh man.
Stay over there.
Man, he's a good scrub tech.
Are you on the top of the doctor?
Yes, you can tell. When it comes to sterility, doctors are put in their place. Yes. Good job.
Well, if orthotech doesn't work out, you should go to scrub tech.
Yeah. Sass every doctor that comes your way.
Good.
He'd like that too.
Just the cute ones.
Okay, now you can start scrubbing. Keep going. Now hurry it up. Don't let it get on her pants.
It's
If it's on
on
her
the
pants.
pants.
It's not coming out.
Posterior.
Great.
You want this beauty?
It's on the pants. It's like that.
My scrub still has to stay, Haley, if you'd like to look and see what it looks like.
Oh,
That's good.
See it?
If that's not good, you gotta do it all the way up, all the way to
Yeah,
your toes.
yeah, actually.
I can find that way.
Forgot you gave it to me.
Because what happens is you put that stockinette on. If this isn't sterilized or cleaned, then that you're rolling it over.
Get all down the leg on the side. You missed the whole side.
Good.
There you go.
I like it. Telling them what to do. Oh man, that sucks ass. What do you do?
Yeah. Just leave it. I'll try to run this. What is it done? It's just gonna pop over anyways.
Damn.
Will, what are you gonna do?
Somewhere else.
What do you do? There's something that you can do. Besides stand there and look at yourself.
Hand the little one over to him and have him tie it in the back.
There is the proper answer. Hand that to him. Yep.
I already
Yep.
got there. It took me a half an hour, but I already got
Wait a minute, wait a minute, wait a minute. You have to hold. She gotta go scrub her hands now.
That was way down. And then hold it.
Yeah, go ahead. Normally you take over you need her to go scrub as soon as possible because she's got stuff to do.
Hold it like you do right side over.
There you go, sir. Yeah, I would just throw them on the ground or whatever. Now, you guys can go and... I'm liking it. Don't get me wrong, I'm liking it. Even in real life, you can always bitch about somebody else's work, somebody else's job.
Haley, that's a really good color on you.
Kind of like that fake tan.
Yeah. I was about to say, let's spray on 10.
She got away easy.
You
That's
can't
not a
take it
lot.
home.
Are you gonna pay him for that, Haley?
Yeah.
Get a foot massage while you're up there.
It's like, oh, hell no.
These tourniquets aren't, I don't say not the tourniquets, but the stockinette, they're not necessarily all sterile, or are
They're
they gonna-
sterile. The problem is that they're not impervious.
Okay.
You know what I mean? And then also, if this isn't cleaned, you're rolling dirty over clean.
Right.
Got it? So you always, everything distally gets cleaned.
Why do a doctor choose impervious versus pervious on the stockinette?
Some people just, because the toes are, they consider filthy, nasty, you know what I mean?
Mm-hmm.
So that would be one. Normally total joints, where they're really anal about bacteria, you can go ahead, they'll do that. But scopes, knee scopes, ACL, stuff like that, stuff that's not in the joint, well, it is, but they're washing a lot of fluid through the joint, you normally don't. And the reason is because knee scopes very rarely get infected. Rare. Total joints is 1%, although when you see one, you'll be like, fuck, don't ever give me that operation.
Well, Eric said something like 40% or 50% to get an infection of like a hip.
That's
Die.
way high. It's supposed to be 1%.
No, they get the infection. 50% die.
Oh, that might be true. For sure.
Something crazy.
Because an infection's hard to get rid of. Then you're laying around doing nothing and you're old, you know what I mean?
Yeah.
And you're on antibiotics, and the infection is hard to kill because in a joint, the body doesn't attack it. So you can scrub your hands, man. Oh, you're scrubbed. Perfect. Scrub tech's a little slow. Did you already dry? Did you give him a towel already? Oh, we did. Perfect.
That was like, well. You see that?
Very good.
Like slapping paper.
Good job.
She did it.
I just watch your video and see if they did it for all the things I can't see. You can't. Don't even think about that yet. No. You're not tied up.
Why don't Why doesn't he tie her back?
It's exactly what a doctor. Fuck, man, I got like 6 surgeries. You're killing me.
Should have poked them.
All right, now the doctor would not take that. The doctor would not take that one.
Need a better staff. You should hire me.
You scored a touchdown? What?
Get through this.
It's the best one.
Standard OR practice.
Well, I seriously vote you like dropped this program. You're the best scrub tech there is.
So how does this work? Now what's going to happen?
Someone take over for time.
You can't tie him.
That's why I said should
You
have tied him.
can't tie either. So what has to happen? You have to free up his hands to tie them up. How are you going to do that?
Come take the lead.
This is always the tricky part. There's not enough people in the room. You could take a towel, or there's one thing else you could go straight to. Skip the towel.
Stockinette. Stockinette.
Stockinette.
Yeah, there you go. You hold it.
Yeah, nice. Now this is where you got to be careful because what? Because you're not tied. Yes. Now you got the leg. Don't you contaminate your gown. You have the leg. Up, she contaminated. So what can you do? What can you do? Go this way. There you go. Keep going. Push it down. Now you can get the leg without. You gain a little bit more room. Be careful. Just bring the leg out to the side.
There you go.
Good. Good. Put your ass over there and tie him up. Tie him up. What are you thinking? Will, where are you going next with this?
Probably a straight.
Or a down sheet, right? Is there not one up there? Those are splits, I think. Nope, this one's not. I don't think this is a split.
Split would be that one, right?
No, that's not a split. This one will work.
That's a split.
No, neither one of those splits. This is not a split.
This is not a split. This
No,
is
no.
big.
No, this is a fenestrator. Use that. They do that hand off part, right? She can't hand off yet because she's stuck. Okay. You and the doctor. She's holding the leg. So what I would do in this situation is I would now come to this side of the bed. Very good. And hold. You on this side. Doctor on that side. You want to kind of go under the leg, yes. That's because you want to leg it toward, yep. Very good. Look at that. Nice. Go way up. There you go. Perfect. Nice. What's next? Mm-hmm. Look at, there's a picture of a guy right there next to the hole. Tells you which way the head goes. You're gonna put that leg right in that hole. Good. You know, push it up as high as we can get it. There you go. Oh, you don't want to go over top. Perfect. One thing left to do.
Chris,
You can put the leg down now, right?
weren't you saying something about when you lay that out, not to have the bottom touch, I mean the bottom of the section, or you know what I mean, like have it one touch.
Very good. She's got to do that part. Nice. Best one yet that I've seen. Good one. Good job, guys. What else you got over there you want to? I think we're okay. I think we can stop with that. I like it.
Isn't the knee
I'm
typically
sorry.
up?
Sorry?
Isn't the knee typically?
No, not always. Sometimes if they're doing a knee scope, they'll drop the knee to the side of the bed and they'll scope like this. The reason for that is because some doctors can do this all themselves if they don't have an ortho tech, but they still have a hard time doing a figure 4, getting in the lateral position because they have to maintain this and hold the scope. So it's way easier if you do have somebody to help. Knee scopes, I can do a knee scope with a physician and I follow him exactly what he needs. As he puts those scope in, I know exactly what position the knee needs to be in. Whenever he finally gets in the knee where he wants to go, I know exactly what, where he is at. I follow him all the way. I see him start to drop into the medial side, and I'll open up the leg. I'll externally rotate and actually open up, giving him a little bit of valgus stress so that he can get in the medial side a little bit easier with that scope. And then whenever they go into the lateral side, normally he'll go right into the notch from the medial side first. And when he's in the notch, you just kind of let the leg hang. He might work in the notch looking at what? What's he looking at when he's looking in the notch of the knee?
ACL? I don't know.
ACL and PCL.
Hmm.
Then from there, he'll go over to the lateral side, and I'll follow him as he starts to go over there without him even telling me. I'll pick the leg up and force a figure 4, given what am I doing to the knee now? Giving a little bit of varus, and I'm also rotating the foot internally. And what that does is actually brings the posterior side of the meniscus forward. That's always the hardest part to see, is way back in the back of the knee. So then I'll let him get in there. And sometimes if thank God, the majority, because this is your backbreaker right here. Look how this is not ergonomically correct. I mean, I'm leaning over the table. Sometimes I'll do this, but then I can't really rotate. So, it's kind of hard on your back to hold a figure 4. I prefer, most of the time, meniscal tears are on the medial side anyhow. This way, you just kind of hold, and I'm skiing. Kind of hold now. They have a bar that kind of holds this. I just kind of rest it. And if they're an older patient, these people get really tight knees. Sometimes I'll rip the MCL. Yeah, so you got to kind of be careful. You're not going to do it on a young person. There's no freaking way. I mean, I've had doctors say, Chris, try to rip the MCL because they can't get into that side.
Oh, sure.
If the MCL was ripped, then they can get in there a lot easier. So there are times whenever they want you to do it, but it's kind of rare, very rare. And in the little old ladies, you might find it pretty easy, but the younger people, you're just not going to find it. It's not going to happen.
What happens then?
Then what do we treat an MCL with? MCL brace.
Just MCL brace.
Yep. So they'll wake up with a big fat A-strap on and a brace versus no brace. It's still a 6-week ordeal. I mean, they're not going to be 100% for 6 weeks anyhow. So that's how long an MCL takes to heal. Any questions? Piece of cake. This is your standard. The other way that they do knee scopes is they drop the foot of the table, which is really popular, especially whenever you're doing ACLs. And what this will do is this leg will be in a, like a stirrup. This leg will be in a stirrup. Like when they give birth. And then the bottom of the foot will drop out. And then this leg will be literally doing the exact same thing as if it was off the side. Just kind of sits and holds, and they have a leg holder on it. That's the other way to doing a knee scope. So it's either going to be straight supine like this, or straight supine with the leg broken. And it's really, really popular if you're a sports medicine doctor and you're doing a lot of ACLs to just break the table. But your standard knee scopes, they won't do that. They pretty much just do it all like this because it's kind of a pain in the ass to break the table. If you're doing a patella fracture, it's going to be supine. If you're doing a medial lateral tibial plateau fracture, it's going to be supine. I can't think of any procedure on the knee where it would be lateral or posterior. Maybe a Baker's cyst, removal of a Baker's cyst, which is very rare. I don't think of it. I've popped a few Baker's cysts, but I've never actually gone in or physically removed a Baker's cyst. So that would be the only thing that you could do posterior. Any questions? How to set this up? This is easy. This is the exact same. Knee and foot are the exact same. So the next group of people should be no problem, right? Should be even better than this one. You guys did good, by the way. I like it. I like the way you were doing, yelling at people. I like what you were doing. Doctor, you were being way too nice. We need to work on you. You were thinking too far ahead. But other than that, I thought you guys did pretty good.
Same for total knee?
What was that?
Total knee? Same?
Total knee would be straight supine. They'll come with different types of leg holders to help with the knee. Because when they make the
Knee's
cuts,
bent, I think, right?
Yeah, that was what I was actually asking.
The knee's
Is
bent,
knee
right?
up like
yeah,
that?
they'll make the cuts with the knee bent, but a lot of times they'll also make the patella cut with the knee straight. So they have to be able to range the knee.
Hmm.
Go ahead, Papa.
Like, it seems like it's just so easy to, like,
Like, in the middle, like, next to the sky.
yeah.
Oh, but that's what, like, Chris was saying, like,